Good evening. Welcome to the Ask Me Anything with Dr. Twyman. I'm a board-certified cardiologist. I help people avoid heart attacks and strokes, and I've been doing this since I graduated medical school in 2002, but this has been my primary gig since 2019 when I launched Apollo Cardiology in St. Louis, Missouri with my amazing team. We help people from all over the country and actually the world. We have people from Qatar and Australia joining us this year to get their vascular screening. And I know there's a question about how people from out of the St. Louis area can get potentially screened with us. So today we have a nice snowy day here in St. Louis. I've been doing telemedicine with some people around the country. So hope you guys are staying warm and enjoying your Thanksgiving recovery. So we'll jump right into the questions tonight. First question up tonight is, what are my thoughts on lysine as a reversible competitive LPA inhibitor? That is part of the protocol from Linus Pauling. His theory was that atherosclerosis was subclinical scurvy. If you used high-dose vitamin C, lysine, and proline, that it would bind to the receptors where LPA bound, and that LPA would not be able to contribute to atherosclerosis. It is a theory, so as such, not been proven. Challenges is that there are no labs that you can point to that it's working, so you can only look at the health of the arteries, and that's what my specialty is. So doing carotid intimal medial thickness scans, CT coronary calcium scores, CT coronary angiograms, endothelial function testing, looking at the health of the arteries, and then if people start the Pauling protocol, repeat that testing generally 12 months later and see, are the arteries as healthy as you expect? If you're developing more significant plaque, then it may not be working for you and you want to be doing something other than that protocol. But generally safe, it's just that there's no labs you can point to that it's actually working for you. Question tonight, how to improve blood circulation naturally or with medicine? So your endothelial glycocalyx, which lines your arteries, is a protective gel coat. It's heavily hydrated with structured water. It is negatively charged. Your blood is a plasma that should easily float over the glycocalyx. You want to get negative charge from grounding, from light exposure, so sunlight or sauna therapy. The more electrons that you have coating your red blood cells, the more your blood flows effectively. Infrared light is key, so sunlight and sauna can help with that. Medications, there are various medications that can potentially improve it, but you want to use the lifestyle interventions first. If there's oxidative stress or inflammation, then treat those root causes as well and get the arteries releasing more sufficient nitric oxide. That will also help with blood circulation. And here's the question from somebody asking, do I have a program for the out-of-town people to come in and get evaluated? Yes, I do. It's called the Deep Dive Program with Dr. Twyman and his team at Apollo Cardiology. So for the deep dive visits, those are done in person in St. Louis so that we get to know you as a person, perform a physical exam, and then you have access to all our non-invasive testing in our office. So it's a one-stop shop. We have access to the best lab testing through Boston Heart Diagnostics, Cleveland Heart Labs, and then genetics if needed through Vibrant America and GB Insight. And then if you need a CT coronary angiogram with Clearly, we're the ones that got it arranged in St. Louis. We're the first ones doing it in the city. So we can get everything done in one visit. Follow-up visits can be done remotely via telemedicine, via Zoom. That's usually what I do on Mondays with patients. And then typically 4 to 6 months later, we do a follow-up visit, again via Zoom, going over any updated labs or updated things that are going on in your lifestyle. So if you're interested, my team can help you with that. My website, drtwyman.com, has the application. At this time, I'm pretty much booked up for the next 3 to 4 months with new patients, but I'm still going to keep the practice open next year as long as I can. There are going to be some changes in 2026, so that'll be coming out of my newsletter in the next couple of weeks, so stay tuned for that. Question, does taking testosterone in women, if it's low, increase it says HA if you have coronary artery disease. So I assume it means heart attack, not headache. Should not, as long as your levels are kept in physiologic ranges. So generally, a woman's testosterone is about 1/10 what a man's is. So most men generally have testosterone between 500 and 1,000. So a woman may be between 50 and 100 on the total. And then the free testosterone in a man generally is optimal around 100 picograms per milliliter. Maybe it's nanograms per deciliter. So whatever one gives you close to 100 is what you want to look for. But in a woman, that would be 1/10. So 10 is generally the value you look for in a woman. The risk with testosterone replacement therapy is that it tends to increase people's blood pressure by making them hold on to more water. So monitoring blood pressure is the key because that is one of the biggest silent risk factors for worsening atherosclerosis. So as long as your blood pressure is normal, no significant concern for being on testosterone replacement therapy. Does hydrogen inhalation provide benefits for cardiovascular disease? It's a selective antioxidant. It may be beneficial. The real question is, how is the hydrogen gas being produced? If it's having lots of deuterium, then maybe it may not be beneficial, as the deuterium will cause energy flow to slow down in the mitochondria. How would you know how it's produced? That's a good question. So you have to kind of talk to the person who's creating the hydrogen gas for you. All right. So that was the pre-submitted questions. If anybody has a question they want to drop in the comments, I'll answer it for you. We're waiting for any questions to pop up. My website, drtwyman.com, has the application for people who want to work with us. Again, I'm booking out 3 to 4 months in the future, but my team will contact you to set up a call and make sure our practice is right for you and that we can help you with the things that you're interested in. My Skool community, which is drtwyman.com/Skool, or if you go to skool.com/drtwyman, it'll take you to the same site. I have over 30 members in there that, are participating. We, basically do day in the life of Dr. Twyman at times. I share articles that I find interesting, podcasts that I find interesting. Weekly, we have a poll, the top, upvoted topic. I'll usually put a 5 to 10 minute video together for the group. Sometimes we've been experimenting with kind of a longer form Ask Me Anything like this. And then monthly, we do a live AMA. People log on. You can see them. They can share more information. It's a little bit more back and forth than what I'm able to do through Instagram. So if you're interested in the Skool community, that's where I'm dropping most of my long form content these days. There's a free 7-day trial. Check it out. If it, sounds right for you, hanging out with us. It's $20 a month. That's mostly just to get people engaged and that I can get feedback on what you're interested in so I can keep developing that content for you. My YouTube channel is drtwyman.tv. That's where the archives of all these Instagrams go eventually. I'm using AI to summarize them, pulls the transcript, puts it in a kind of a form where you can search it a little bit easier if there's a question you have. I've probably answered it before, but if not, searching that archive will be the best way to find it, or ask me again here. So let's see if any questions popped up in the comments while we're chatting. So, is heart failure reversible? Yes, it depends. If it's due to ischemia or non-ischemic. The heart is a muscle. Muscles have mitochondria. Your heart potentially has up to 5,000 mitochondria per cell. If your mitochondria aren't making energy efficiently, that can contribute to either diastolic heart failure, where the heart doesn't relax well, or systolic heart failure, where the heart doesn't squeeze well. Figure out what's causing the mitochondrial dysfunction, and the heart function could improve. I've talked about previous things that improve the redox potential, but the answers of optimizing infrared light into your surfaces is important. Grounding is important. Optimizing your sleep. This is where sauna therapy can be beneficial as well. All right, next question. If my LPLA, ApoB, LDL are high, but triglycerides are low, calcium score is 0, they're not overweight, do you think you should be on a statin? It would depend. It depends on how old you are. If your calcium score is 0 and you're 70, probably low risk. If your calcium score is 40, that is if you're 40 years old, your calcium score is 0, that is expected. Having high LPA and high ApoB for 30 or 40 more years, if you're more risk averse, treating them early may reduce the risk they develop plaque. If you want to wait until you develop plaque, sometimes it's a little bit harder to treat. Statins are just one of those tools. Statins don't lower LPA, they only lower LDL particles. So if you're more interested in lowering LPA, that's really apheresis or PCSK9 inhibitors. You can also use a Boston Heart Lab panel to understand if you're a hyperproducer or hyperabsorber of sterols. That can also guide therapy if you're interested in treating your lipoproteins, which most people, their goal should really be an ApoB of 70 or less, an LDL particle of 1,000 or less. All right, which beverage is best first thing in the morning? Orange juice, warm lemon water, or just a plain glass of water? Probably the water or the lemon water is probably preferred. The lemon water can help structure the water. Orange juice, lots of fructose and sugar early in the morning. You'd want to have protein with it so you don't have a big spike in blood sugar. So not a huge fan of a lot of orange juice. First thing in the morning, at least. All right, so I think short and sweet again. I think we got people post holidays, are still not on social media as much as they were. That's fine. I'm here every Monday, 6 p.m. Central Time, answering the questions that do pop up. I drop the story in my feed early Monday morning. So if you want to ask me a question, that's the best way to do that. If there's plenty of time, you can always drop them in the comments if you join live. The archives are on my Instagram feed in the archives, as well as my YouTube channel, drtwyman.tv. I appreciate your guys' time and attention. Your questions are great. They help educate the masses. This is the stuff that I answer with my patients one-on-one. And so if you're interested in working with me, outstanding. If you can't make it to St. Louis and you want to learn more, this is the best way. In addition, just follow me online and following the different podcasts that I'm doing. So hope you guys have a great week, and I'll see you next Monday, 6 p.m. Central Time.